Hi, I'm Dr. Tripti Patel, founder of Physicians Premier Weight and Wellness Center. Often I find my patients suffer from metabolic syndrome without even realizing it or knowing what to do about it. So what exactly is metabolic syndrome? It is a very common syndrome with rising numbers in recent years. Metabolic syndrome is really a group of conditions that put you at a high risk for heart disease, diabetes, and other health conditions. To have this syndrome, you must have 3 of the following 5 criteria. The first criteria is a large waistline. This means a waist circumference greater than 40 inches in men and 35 inches in women. Keep in mind, though, that these criteria are different in men and women of Asian descent. This is often referred to as abdominal obesity or having too much fat around the stomach. The second criteria is high triglycerides, or a number greater than 150. Triglycerides are free fatty acids that are measured when you get a full cholesterol panel checked. The third criteria is a low HDL. This is also known as good cholesterol. In men, this would be a number less than 40, and in women, less than 50. Again, HDL cholesterol is typically measured when doing a full cholesterol check. The fourth criteria is high blood pressure. This generally means readings consistently greater than 130/85. Persistently high blood pressure over time can damage the heart and kidneys. And the fifth criteria is a high fasting glucose. This is a number greater than 100. When you have any 3 of these above criteria, you have metabolic syndrome, putting you at a high risk for diabetes, heart disease, and stroke. Unfortunately, there are no symptoms of metabolic syndrome. It is something that is diagnosed by your physician based on the above criteria. So what causes metabolic syndrome? Some of the causes are having excess weight, a sedentary lifestyle. Another cause is having insulin resistance, which is a condition in which the body can't use insulin properly. Insulin resistance leads to diabetes. Age is another cause. As age increases, so does the risk of getting metabolic syndrome. And like so many other conditions, genetics plays a role as well. So if you get diagnosed with metabolic syndrome, your question is likely, how will you treat it? The most important treatment is changing your eating habits. This is where a heart-healthy eating plan becomes essential. In fact, following a Mediterranean diet, which is high in good fats, lean proteins, and plenty of vegetables and whole grains, is the best medicine. Another treatment for you is to target a healthy weight. Aim to decrease fat mass while keeping muscle mass intact or even increasing it. A third treatment is to decrease your level of stress. High levels of stress create havoc in the body by increasing inflammation, which leads to so many health problems. Fourth, get plenty of exercise. Aim for about 150 minutes of moderate to high intensity exercising weekly, combining both cardio and strength. If lifestyle changes do not help, then medication may be needed to control high blood pressure, high cholesterol, or high blood sugars. But the best way to avoid metabolic syndrome is to prevent it from happening in the first place. Take control of your health and make certain lifestyle changes before it happens. This is often easier said than done, and it happens to be my area of expertise. If you want to lose weight and improve your health or fear that you may have metabolic syndrome, please reach out to me at healthymeweightloss.com or give us a call at 703-783-5673.